John Howard hasn't publicly visited an old people's home in 4.5 months.
Why, Minister, did your government cut $500 million out of aged care?
The concept of individuals having been bathed in kerosene was, in this day and age, just beyond belief.
Well, I don't accept it's a crisis.
The family home will be at the centre of how we will deliver aged care in the 21st century.
The horror stories about the care of elderly Australians and the political brawls about funding have abounded for too long. Governments often claim to be making historic or game-changing reforms, and if there was one area where both were really needed, it would have to be aged care. But the reforms announced this week, if implemented, truly are transformative.
When Labor did Living Longer, Living Better, we had about 60,000 home care packages. This year, next year and the year after, we will put out 120,000 packages and we will end up with 276,000 packages. That's more than the number of beds, residential care beds. That's a revolution in home care. It's a revolution in aged care.
As an advocate for the aged, Ian Yates has watched or been part of most of the policy changes for over 20 years, so he's in a position to understand just how big a change it is. And it needed to be. While the exposés of appalling conditions in aged care finally provoked a Royal Commission, the underlying foundations of the whole aged care system have been creaking for decades under the weight of an ageing population and shifting patterns of care. The first changes will be to the home care system. The rollout of 40,000 places already this year, even before the 80,000 announced on Tuesday night, tells us a lot about how difficult the task ahead will be.
What we've learnt is that you probably can't do it any faster than that because of the workforce pressures. And also that we need to pay more attention to quality measurement in home care because it's actually more difficult. In residential care, a team of assessors can visit, look around. We can't send them into 276,000 homes.
It's a huge change, designed to address a waiting list for 100,000 home care packages, particularly for the more intensive levels of care, which have the potential to genuinely change the decision-making calculus of families considering residential aged care. Bill Harland was getting some help at home before he moved into aged care, with tasks such as cleaning, but not with cooking 3 meals a day for himself and wife Sybil.
I think it probably is.
Sybil was getting sick and tired of what I was giving her, and breakfast, lunch and dinner, and maybe a cup of tea morning and afternoon. I think it's just it's very nice, when it comes automatically with a smile.
Chris Marmaralis is the CEO of the aged care home where Bill and Sybil now live. He was watching the federal budget closely, particularly for measures that will help attract the workers the industry desperately needs.
There were some positives in terms of the incentives for registered nurses. I think that's a really valuable component of the budget, particularly out in the bush.
Both home and residential aged care are beset by workforce shortages because pay rates, which start at just over $20 an hour, are so relatively low.
So how are we going to find those numbers? If the industry achieves a higher level of quality, and then particularly that's residential, as the norm, then more people will be interested in working in it. A lot of people like to work with older people, but they find it frustrating when they're working in a non-quality situation.
In the residential aged care sector, the large casual workforce often has to work in several different homes to make ends meet, a factor in the catastrophic spread of COVID at the beginning of the pandemic last year. There has also been a gradual reduction of training requirements for carers and in the rules for nursing staff to be on site.
I'm most concerned about the level of staff and also the experience. We're losing more and more staff each week.
7:30 first met Anthony Bowe last year. He's the son of Patricia Shea, who last year survived COVID when it swept through the Newmarch House aged care facility in Sydney.
Hey Mum, how you doing?
He's sceptical about the plan to mandate 200 minutes of care per day, including 40 minutes with a registered nurse.
Currently Mum gets about 30 or 40 minutes of one-on-one care a day. She needs that at the moment, but this idea of 200 minutes per room is just not realistic at all. You'd have to triple, quadruple the staff levels, and they just haven't got those staff available, and they won't pay for them. These operators will not pay for that.
Crucial to the future of the sector will be a case currently before the Fair Work Commission. Late last year, the Health Services Union launched a case for notoriously low-paid aged care workers to get a 25% pay rise, or at least $5 an hour. The Royal Commission explicitly recommended that the government collaborate with employers to get wages in the sector increased. But to date, the government has chosen to not intervene in the Fair Work case. Instead, it will rely on the new Independent Pricing Authority, which will scrutinise fees in the sector to indirectly push wages higher.
It's not usual for governments to intervene in those kind of cases. However, I would have thought that they ought to seriously think about saying, this is an exception. We are trying to lift a whole industry here.
We do want to see their pay increased. We know that workers in other sectors, in similar sectors, in disability, for example, are paid more.
The immediate financial change to the residential aged care sector will be a $10 a day increased payment per bed per day. And the first new quality test will be how much of that $10 is put towards food.
The government has given providers an extra $10 per day per bed. And for that, they're asking them to report on what they're spending on food. You can then identify the people who are not spending much. And that, I suspect those people will pretty quickly get an unannounced visit from the Quality and Safety Commission.
Aged care providers will be paid that $10 basic supplement, and they'll be required to report on how they've expended it back to the government, and I believe publicly, so that the community can see how the taxpayer funding has been spent.
In addition to the $10 a day test, the new accountability regime will involve more surprise inspections and more scrutiny of home care providers. With more transparency, the pressure will be on for providers and the government to produce a lift in standards.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.